Hey, hi Noah.
Hey you.
We've got a young man who's got something going on. Let's go see. This episode is brought to you by CleverRx. Everybody likes to save money, and everybody should be saving money when it comes to your prescriptions at the pharmacy. I have a prescription that I was paying with insurance almost $100. With use of my CleverRx link, that price is down to $13 and some cents. You simply need to click on the link in the description, download the app and put in the group ID number, or use the QR code we're showing you right here. This is the best in class program for pharmacy discounts. I use it myself. You're gonna support the channel and you're gonna save lots of money. Hello, thanks for waiting, you guys. So I'm gonna borrow this stool because I'm an old guy. You're my patient today. Let's start with issue number one.
I've got allergies, my eyes are inflamed, and I get sticky eyes.
Do you have a runny nose too?
Yeah.
Okay.
And bloody noses.
And some bloody noses, okay. Have you had trouble with wheezing?
No.
Asthma?
No.
And do you have any dry skin issues? Eczema?
Yeah, I have eczema on my arm.
On your arms? This area? Yeah. All right. So what I was covering there was the atopic condition, folks, where I could actually draw out a circle for you on here. There's 3 different presentations. And here we've got asthma. Here we've got nose and eyes. So that's your allergic rhinitis, allergic conjunctivitis. And here you've got eczema. And notice you could have 2 things. He'd put you in that box, or you could have all 3. You could have the eye, nose symptoms, the asthma, and the eczema. So you used to have asthma, you don't anymore, thank goodness. That's the most severe. And we've got allergic rhinitis, conjunctivitis, and a little bit of eczema. And I've already examined him, so I know this is very mild. But that's the situation. So for this condition, have you ever had any testing done to figure out what's causing it?
No.
Okay. We chatted earlier, and you're willing to get that done. Perfect. So we will do a test called ImmunoCap, and you can test a whole panel of environmental allergens. The most common I'm here in Oregon is Timothy grass. I'll bet you if you went and worked with hay in a horse barn or something, you would come out like red eyes and runny nose. It would be horrible. So probably your worst symptoms are when it's dry and windy in the spring and summer.
Yeah.
Because the pollens are just blowing around and it's just like, boom, it's a big load. You can actually do some things if you have to be outdoors and it's one of those days and you come home and you're miserable. Strip off all your clothes because stuff's on your clothes. Get some saline nose flush. I don't know if you ever heard of it.
Yeah.
Yep, you can spray it or Neilmed and just spray out as much of there's stuff in your nose, right? You can just spray that out. That'll lower that load that you're living with for that moment. And we'll talk about things you can do to decrease the symptoms. There's eye drops, there's nose drops, and then there's the antihistamines like Claritin, Zyrtec, Allegra. You can use any one of those at the adult dose, given your age. And if you have still a very severe episode, you were to see an allergist, they'll sometimes say you can double up. You can take one in the morning, one at night, even though they're normally one a day. Or you could take one kind, Claritin, Zyrtec, or Allegra in the morning, and a different one at night, if you're having a really severe episode.
Okay.
So we'll talk about all those options here in a moment. You had another issue you wanted to bring up.
Yeah, I have some issues with my heart where, like, sometimes if I get sick or if I don't eat something in the morning, like, my whole face turns white and my lips turn blue, purple-ish.
They flesh white, and he usually is lightheaded, like he's about to pass out, and I mean, as a parent, I should have gotten him checked out before with that, but it's been reoccurring, so I don't know if it's a sugar issue, like a blood sugar issue, or if it's an actual heart condition. Okay.
How many total episodes, and how often are they happening?
They happen like every 2 months, I'd say.
Okay. And they last how long?
Probably 10 to 15 minutes.
Okay. And then after that 10 to 15 minutes, you just, bam, you're fine?
Yeah, I'm fine.
It's kind of a sudden getting better?
Yes.
Okay. Yeah, it brings to mind to me a couple things. We're definitely going to evaluate this. There's a condition, I went to medical school with a gal who had something called SVT, supraventricular tachycardia. It's where your heart, for various reasons, starts beating 200 times per minute. The heart needs to fill up with blood and then contract to feed the whole body. Well, if you're doing this, there's not enough time to fill up. And so pretty soon, in a matter of a few minutes or so, you could be getting pale and feeling lightheaded and all of that. And so that's easy to pick up because that's like the only thing that'll cause your heart rate to just jump to 200 and then boom, back. And there's some things you can do to get it back. We'll talk about that. Something called the Valsalva maneuver. You strain, you grunt, you get on your squat and knees, and if you're a little baby, you put ice on their forehead and boom, you shock them back out of that rhythm. That's a possibility. The other thing that comes to mind is an arrhythmia, where some other rhythm disturbance, well, SVT is an arrhythmia too, but some other disturbance of the heart rate causes it not to pump efficiently, and you get pale. So we'll definitely send you to cardiology, get an EKG, and they'll probably do an echo just to make sure your heart structure is okay, which I'm sure it is, but just to make doubly sure, right? Send you to the specialist for that. That part I can't do. All right, I'm gonna take a quick look at you. We're gonna start off with those amazing, beautiful ears you got. That one's perfect. No, they're actually not that dirty. Not that dirty at all. That one's perfect too. Let's see your throat. And I'm gonna look in your nose just because get a clue to allergies looking in the nose. And indeed, you do have slightly pale, slightly swollen nasal terminates. If you look at this picture here, I'm looking in the nose, those are the nasal terminates. And they get a little more swollen, a little more bluish when you have allergies. That doesn't look too bad. Were they crusted shut today?
Yeah. Huh. I couldn't open my eyes.
Really? I'm sorry. Excellent. Again.
Cutie brains.
And again. Perfect. Your heart rate just goes boom, 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 boom. Little pause. Boom, boom. And it's slightly irregular. So definitely that EKG might be helpful. Yeah.
So you did hear kind of something a little...
I heard something. Now there's a sinus arrhythmia, which is normal. And it's just a very slight variation. I wasn't sure if your variation was a little past the slight. So definitely my guess is the cardiologist will figure this out. Okay. And once they figure it out, they'll know what's the best approach. Yeah, I don't think you're in any danger, but you just gotta let them figure it out. Cool. All right.
Why don't you think he's in any danger?
Well, it happens infrequently. It's been going on for years, and he's here smiling in front of me. So just odds of him being in danger right this moment are very, 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 very slim. Sure. But is it something that should be figured out? Of course, right? Just because I'm not a cardiologist. So, yeah.
Right.
Awesome. Like your Crocs. Wow, those are, look at those. Look at those babies.
Well, there are some good Crocs.
Some excellent Crocs. So folks, this is what we do in pediatrics. Sometimes we get 2 for 1. So we've got 2 interesting things that we can help you with. The cardiology, I'm going to defer to the experts. The allergy stuff I can deal with. I mean, there are allergists, and we are going to do an immunocap, which is going to look at the environmental and the food panels, and we're likely going to figure out what you're allergic to. Okay. We had discussed earlier if you had pets. You don't have cats or dogs, and I would say hold off for now anyway, because when you tend to be allergic, you can become allergic if you get a cat or a dog, and then what are you going to do? They become a part of your family. I'm not saying never have a pet, but it's something you want to really be thinking about. Have you had exposure to cats or dogs at friends' houses?
Yeah, but I don't really have like any reaction to them unless it's like a husky or something and it's just shedding hair.
You have had a reaction to that?
Yeah.
Okay, then the immunocap might show it.
Yeah.
And then you'll say, oh wow, good thing I don't have a dog. Yeah. Very good. Thanks for watching, folks. I'm Dr. Paul. Like this video, share this video, because all we're doing is here for education, folks. Thank you. Oh, do you have any special comments you'd like to make to your audience? You know, you've got 1.6 million potential viewers here who are subscribed to this channel.
Subscribe.
There you go.
YouTuber, right?
So we're gonna actually do his labs in the first thing in the morning when he's fasted, because it's late afternoon, he's had breakfast. There's a good reason for that, just to make sure his fasting glucose is okay for one thing. And he's at an age where it's not a bad idea to collect a cholesterol panel while we're at it. We're definitely gonna get a vitamin D level. Low vitamin D can make allergies worse. So we want to figure out where the vitamin D3 status is at. Yeah.
Cool. Well, thank you guys.
Yeah,
Appreciate it.
absolutely.